And welcome back. Thom Hartmann here with you, and I'm super pleased to have with me in the studio Dr. Elisabeth Rosenthal. She's a former ER doctor, now non-practicing, and a New York Times reporter for 22 years, now editor-in-chief of the Kaiser Health News, and she has a new book out. It's called An American Sickness, How Healthcare Became Big Business and How You Can Take It Back. And we'll get a picture of that up on the screen in a moment here. Dr. Rosenthal, welcome to the program.
Thanks for having me.
Thanks so much for joining us. You need to be within about 3 inches of that microphone, so I can just move it a little closer to you. There we go. It's the old eat the mic thing here.
Okay.
So tell us about what prompted you to write this book in the first place? What need did you see that needed to be filled in terms of information?
Yeah, I'd been a journalist for decades, but this was the first time I felt compelled to write a book. I come from a family of physicians. I trained as a physician, but I saw that U.S. medicine had moved from being focused on a caring profession that I cared a lot about to a commercial enterprise, and that many of the motivations behind the care we get now are financial motivations rather than what's good for our health. And that really bothered me. I did a series for the New York Times called Paying Till It Hurts about the high price of medical care. And when I was done with that, we did a lot of social media, and I got literally tens of thousands of comments, people's stories about not that they didn't like their care, but the burdens that the financial costs were putting on them and the difficult choices they were having to make, that I thought, I can't not write a book about this. I have to do something with this material. And so I set about writing a book. And my goal, I think, is to say to people, look, this is unsustainable. It's unsupportable. And when you look at how health policy is made in this country, the insurers are at the table, the pharma's at the table, hospitals are at the table, doctors groups, but patients don't have a voice. And so part of my kind of mission here is to say to patients, we deserve a voice, you can have a voice, and it's time for us to make this a voting issue. Frankly, in my new position at Kaiser Health News, we were looking during the presidential debates last year to pick out bits on healthcare, and there was almost nothing there, even though we know for Americans now, as we're seeing in the town halls the last few months, it's not only an issue of health, it's an issue, it's a pocketbook issue, and we all deserve a lot better value for what we and our government and our nation is paying for our healthcare.
Yeah. I remember in 86, 87, my wife and I and our 3 kids lived in Germany for a year. And one of our next door neighbors became a good friend, and he was a physician. His name was Dr. Geert. And I remember talking with him about how much money he made, which is not a topic that typically you talk about, but he wanted to know about American medicine. And he had been to the United States a couple of times, but not as a tourist. And he said he made, as I recall, and this was in the 1980s, but I translated in my head from Deutschmarks at that time into U.S. dollars, that he was making around $120,000 a year, about twice what a factory worker would make, about twice the average kind of salary, and that he was quite happy with that. He lived a nice middle-class life, and he said something like, I understand in the United States you have doctors who can literally become millionaires, multimillionaires. And I was like, yeah. And he said, that would never happen here. And I said, why is that? And he said, well, not only because the way the system is organized, but because here in Germany, if somebody goes into medicine, they do it because they want to heal people.
Right.
Whereas in America, it seems to me, he was saying to me, some people go into medicine because they want to get rich. And that seems like the absolute wrong reason to do it. How do we, first of all, was his analysis accurate, or my analysis of his analysis? And secondly, what do we do about that? And that's just looking at one little slice of it. I mean, we could say the same thing about pharma and hospitals and...
Right. Right. And I think that has become a bigger and bigger problem. Look, my dad was a doctor. We were comfortably middle class, but we were not the rich people in town. And I think the only good reason to go into medicine is because you want to help people. If you want to get rich, there are plenty of better ways to do that, right? But what's happened as these financial incentives have kind of insinuated their way into medical guy anymore. When I was training, the CEO of hospitals it was a doctor. It was a senior doctor. Now it's a finance guy, and the doctors sound almost Marxist. They're like, we're the labor here, and why is that guy making $4 million? And I think the kind of greed feeds on itself in a way, or not greed, it's more a sense of I'm being undervalued.
I
I
think
worked
it's
really hard and I think the sad thing now is because our system, again, because of the financial incentives, we overvalue people who do procedures and undervalue the kind of physicians we all say we care about, the ones who will spend some time talking to you or will think about a problem and not just order a bunch of tests. So I think we have this weird dynamic right now in medicine where some people, particularly specialists who do procedures, are paid far more than in other countries. And a lot of the primary care doctors, the doctors we all say we want to spend more time with us, less time looking in their computers, are probably undervalued or about this valued at similar amounts to overseas. So I think, when people say to me, who's the bad guy? Who's going to have to reduce their financial expectations in healthcare? My answer is most everyone. That I think it's the whole system.
We're
There's not
twice as expensive as any place on
right.
earth.
There's not one bad guy. And I think many doctors rightly feel that they're under a lot of stress now because the insurers are trying to get money from them. The hospitals are telling them what to do with their patients. And the sad thing is who's getting harmed by the system? Patients who are caught in the middle of this big financial kind of grab to see who can get all this money sloshing away, 20% of our economy. And the doctors who are just trying to do the right thing and not thinking about the financial incentives. I hear from cardiologists who will say, it just doesn't seem right to me. I'm not ordering a lot of tests. I'm working hard to give my patients good care. And the guy down the block is opening a cath center and doing 1 million tests. And he's making $2 million a year. And, here I am. And my point to medical students, actually, because there's a lot of angst among students, is this a good profession to go into? People tell me, all that. And I always say, look, I know, unfortunately, too many unemployed journalists. I know lots of unemployed lawyers, bankers, but I don't know any unemployed doctors. There will be a job. You will be paid reasonably well. You may not be the richest person on your block, but that's not the reason to go into medicine anyway.
Amen. So where do we begin? We just have a couple minutes left here. If we want to rebuild our healthcare system into one that actually works,
Yeah.
do we look at Canada? Do we look at most of the European countries? Do we look at Switzerland, which has no central system, but everything is required by law to be not-for-profit?
Right.
I mean, which model, or do we invent something altogether new?
Well, I mean, I have my preferences, but a journalist, I can't say them, But what I think I've learned from researching the book is there are lots of different models that work. The Swiss model is much more market-oriented, not centralized, but there is a degree of price regulation, right? It's not
Sure.
just a free market. You can go to a national system like Canada's or Great Britain's, which are quite popular. People like the care they get there. We don't see Canadians streaming over the border for U.S. healthcare. So I think what we have to do as a nation is stop getting into these, kind of fine line debates about do we prefer this solution or that solution. We have to pick one and just do it. And that system has to involve a degree of confronting our pricing and cost problem head on. We can't kind of expect the market to take care of it because as we've seen over and over again, it doesn't, it won't. And no other country has managed to do it without some degree of price regulation, control, negotiation, whatever you want to call it. And I think we see in this last election, look, Medicare does price regulation. People tend to like Medicare. In the last election, we've seen both Democrats and some Republicans talk about why can't Medicare negotiate drug prices? Every other country on earth does it.
Well, they can't because the Republicans wrote it into legislation.
Right. Way back when. But now everyone's saying this is a problem, this is a problem, this is a problem. Well, there's kind of an easy solution which has worked in the rest of the world. Politically, we seem to find it unacceptable. But politically, we as patients and voters find these prices unacceptable. So we should be voting that issue in a way that we haven't in the past. But I think as we see in the town halls, people are kind of waking up to this. And I hope one reason I wrote the book is so people would understand that we don't have to accept this system. You can fight back individually, and you should vote your patient slash consumer interests.
We're talking with Dr. Elisabeth Rosenthal, the author of a new book, An American Sickness, How Healthcare Became Big Business and How You Can Take It Back. Okay, we just talked about taking it back. How did it become big business in the first place?
Well, that was a fascinating story to me personally, because I really wanted to understand. I'd been a foreign correspondent for 10 years. So when I left the U.S., prices were kind of heading up, but not so terribly bad. By the time I got back in 2007, it was crazy. I came back and I was getting an inhaler that I remembered costing $10, and suddenly it was $100, even though it was an old medicine, it was off patent, and I was like, what is going on here? So for me, this was a lot of kind of historical exploration. And what we see is that this system of profit kind of unspooled slowly in the last 25 years. And that's the theme of the first part of the book. First we get the sense from insurance that nobody's paying. And of course, if nobody's paying, then the providers say, well, we've always charged $100, but why don't we charge 200 or 2,000? And I think the ultimate rule of our market, if you think that nobody's paying, is prices will rise to whatever the market will bear. And until there's some force that works against that, we're going to continue this upward inflationary spiral, I think. And that's a bad, that you just can't support that. I speak to families who are now spending 20, 30% of their household income on insurance and a little bit of health care. Yeah. And so when people say, taxes are too high elsewhere. Well, elsewhere you're charged maybe 8% and you get all your health care for free. We're spending 20, 30% and we're still paying. So that to me is a really bad deal.
Yeah. I had we did our show from Denmark a couple of years ago, and I had one of the leader of the conservatives in Parliament. And he said, I understand people can actually go bankrupt in America from getting sick. And I was like, yes. And he says, that's crazy. As a conservative, that's crazy. Anyhow, we've got to have this conversation. Elisabeth Rosenthal, she's the author of the new book, An American Sickness, How Healthcare Became Big Business and How You Can Take It Back. Thank you for being here.
Thanks so much. I think we need to keep talking about this.
Amen.